control subjects, and we found the following pattern with regard to attachment style, which is, I think, in line with the international literature. So you see on the left-hand side, the borderline patients, that the majority of borderline patients has one of the insecure attachment styles. So here it was 70% who had a fearful or anxious attachment style, 20% a so-called enmeshed attachment style, whereas the control group had in 84% of cases a secure attachment style. This is nothing new. But here is something new with regard to the evolutionary point of view. Now, people who have an anxious attachment style are not really, it's not really straightforward to assume that anxious people engage in more risk-taking behavior than non-anxious people. But this is what we actually found. So if you look at this graph, you see that people, for example, in the borderline group with an enmeshed or anxious attachment style, but also with a fearful, that was the majority, fearful attachment style, that the degree of the attachment problems correlated with sexual risks in this group. So the more fearful somebody was, the more risk the person took with regard to sexual behavior. You see there was a small but significant correlation with the number of sexual partners or with the number of so-called one-night stands. This is, I think, not straightforward when you look at it from the classical medical point of view. You wouldn't expect that perhaps, but it makes sense from an evolutionary point of view, especially with regard to life history theory. Same thing for the parental behavior that these patients experience. Actually, I should say this is what the patients recall. So it was a subjective rating of experienced parental care, which can, of course, be biased in one or the other way. So we need to be cautious about the interpretation of this data. But you see, for example, that rejection and punishment from the mother correlates with a number of short-term sexual relationships, such as one-night stands. Also, when you look at childhood abuse and neglect, you see that the pattern is very similar. The more neglect and abuse one experienced as a child, the more risky the sexual behavior of these patients was. And on the lower part of the graph, you see that there is an inverse correlation with the experience of emotional warmth and care from the parent's side with sexual behavior. So the less emotional warmth the patients experienced, the more risky they were in terms of their sexual behavior. Okay, so now I'd like to switch to a slightly different topic, because these are more or less epidemiological data, and now I would like to look at experimental interventions or experimental studies that have looked at interpersonal trust, which is a very fundamental concept and highly relevant for the evolutionary perspective, but also for the clinical perspective. If you deal with borderline patients and if you have experience with treatment of borderline patients, you know that it can be very demanding and difficult to engage them in a trustful therapeutic relationship. And if you do something wrong, maybe just the wrong sentence, you may lose that connection, and it's very hard to get them back into the therapeutic relationship. That's what the clinical experience tells us. And according to this very nice review paper by Stanley and Siever, the core of this is a dysregulation of affiliative behaviors, which is, I think, not at odds with the evolutionary point of view. I'm sure you've seen perhaps this famous study by Clínica and colleagues where they played a so-called trust game with patients with borderline personality disorder. So this works as follows. There are two players called investor and trustee. The trustee is the recipient of the money. So both of the players have, say in this example, $20, say 20 euros, and the investor is asked to transfer money to the trustee or to the recipient. So would the investor trust the recipient or trustee to get something back? That's one part. And in this scenario, an experimenter tripled the amount of money that the investor was willing to give to the trustee. So for example, if the investor invests everything, so the 20 euros, then the experimenter triples this amount of money, so the trustee eventually has 80 euros, the 60 received from the investor, and his or her own 20 euros, so 80 altogether. And the crucial question here in this experiment was, how much would the trustee be willing to return to the investor? So the patient or the subject in the study was in the role of the trustee. And what you see usually when you play this game over successive rounds with psychologically healthy people, you see that on average most people return as a trustee around 50% of the money, which in this example would be 40 euros. So there is a classic win-win situation. So both end up with 40 euros instead of 20 at the beginning of the game. And this is what is shown or illustrated by the gray bars on the left-hand side. You see in early rounds it's very close to 50%, and also over successive rounds, many rounds, it remains fairly stable. So it remains above 45% of the total money. Interestingly, when you play such a game with borderline patients, you see initially the very same behavior. So they return almost 50% of the money. But if you play this repetitively, you see that their willingness to return money to the investor drops significantly to around 35, a little more than 35%. And this difference between early and later rounds of the game is statistically significant. Now here's an interesting intervention that the people did in that study. So actually they frustrated the players. They once stopped the investment and looked at the behavior of the trustees. And what usually happens in both healthy people and of course people with borderline personality disorder is that the return drops to zero, which is understandable. If you don't receive anything, you don't return anything. So that's a classic behavior in a tit-for-tat fashion. Now the next step was to try to coax them back into cooperation, the trustees, by making overly generous investments. Now here you have everything, please cooperate with me again. And actually this worked for the controls, they started to cooperate again, but it didn't work for the borderline patients, and I think this is in line with what we experience in therapy. It's, as I already said, it's very hard to get them back into a therapeutic relationship once something has gone wrong in the therapeutic process. And this study nicely illustrates that. Now, this is a very long text passage of a paper from the same group. And now the first author here is Kishida, and this is their interpretation of the finding. Please take a look at the passages in italics. So they say, in contrast, trustees with borderline personality disorder show decreased sensitivity to the social norm of the game, and were therefore less likely to coax back the normative behavior from their partner. This result suggests that borderline personality disorder confers a diminished capacity to represent expectations for social partners, and so forth, and that people with BPD cannot take corrective action that might serve to re-establish cooperative interaction. I think this interpretation is very well in line with the standard medical model. They have a deficit. That's the message. They can't respond in socially appropriate ways. That's their interpretation. I would actually object to this interpretation and argue from an attachment point of view, why should they return to cooperation if their expectation is that there is very little to win in the future. Resources in the future, perhaps it's very likely that there are no resources for me in the future. Why should I go back into cooperation? And I think this is a very different interpretation. It's not akin to a deficit model. I think it tries to explain why they show this pattern of behavior in such a study, which is perhaps not related to a deficit. Okay, now I would like to turn to a few intervention studies using oxytocin in people with borderline personality disorder. I think you're very familiar with what oxytocin does. It's a hormone that is synthesized in the nucleus paraventricularis of the hypothalamus, released by the pituitary gland, and it has a big role in parturition and lactation. That's what it is best known for, and you see on the right-hand side that it's evolutionarily conserved. It's a very old and very simple peptide that has changed very little in the last couple of billions of years. In the last 20 years or so, studies have also shown, sorry for turning my back on you, sorry. Studies have shown that oxytocin has also cognitive or emotional effects. And usually what happens in psychologically healthy people is that it improves social bonding. Whether you look at trust, so if you play trust games using oxytocin, you see an increase in trust under oxytocin. It improves pair bonding in monogamous animals, but also in humans. Famous work by Larry Young and colleagues. It strengthens mother-infant bonding and also triadic family interactions, so it also increases in fathers when you interact with your toddler and your infant. On the other hand, it reduces fear and startle responses. It improves even mind reading, or perspective taking, or theory of mind could be another term. But maybe one of the downside of oxytocin is that it also increases parochial altruism, which is that you start preferring your in-group more, but not your out-group members. So the distinction between in-group and out-group members increases under oxytocin. Evolutionarily understandable. Okay, now there are a couple of suggestions, a couple of papers actually suggesting that oxytocin might be a good therapeutic agent to improve social cognition and affiliation in various neuropsychiatric syndromes. And studies have actually shown that it works. It seems to work in autism, it seems to work in schizophrenia. But how about borderline personality disorder? Could it be the same thing or maybe different? One of the, actually the first study that has looked at oxytocin effects on trusting behavior in people with borderline personality disorder was a study by Jennifer Bartz and colleagues from 2011. They played a game where players were asked to cooperate with one another, and people were asked to choose one out of several possible strategies, where the optimal strategy was the cooperation, AA, where both players received most money as compared to the other strategies. And interestingly, it worked for healthy controls, as you can see on the very left-hand side. You see the light and dark colors, so trust increases in psychologically healthy people in the oxytocin condition as compared to the placebo condition, whereas there is a reduction of trust in the oxytocin condition in patients with borderline personality disorder as compared to the placebo condition. And on the right-hand side, it's basically the same finding, but here it refers to the question what the players expect from their counterparts. But the same thing, borderline patients expect very little, and they expect even less under oxytocin compared to placebo. And interestingly, when the samples were pooled together, so healthy controls and borderline patients pooled, there was a nice interaction with attachment style, showing that people with low anxiety and low avoidance style actually improved their cooperative behavior upon oxytocin, but people who were highly anxious and highly avoidant were the ones where oxytocin reduced or diminished the cooperative behavior in this game. In our own lab, we played a very similar game, but here it was a classic trust game, very similar to the one from Kinkasa and colleagues group, and we modified this slightly because we thought there might be a differential investment depending on the attractiveness, physical attractiveness of the other player, especially from the perspective of the evolutionary point of view. We expected that the difference between investment in a little less attractive person compared to a highly attractive person would be higher in the borderline group, considering that their opportunistic way of interacting with others including sexual behavior, would bias their behavior to invest more in attractive counterparts and less in less attractive counterparts. So that was the idea behind it. And in contrast to the previous study, we did a crossover. We had a crossover design where the same people came 1 week apart and received randomly placebo or oxytocin in the study. So it wasn't two groups, so everybody was his or her own control, if you like. And this is what we found. Interestingly, in line with our hypothesis, there was actually quite a large difference in investment in the borderline group according to the attractiveness of the other player. So the borderline patients invested significantly more money in attractive players as compared to less attractive players, whereas in the placebo condition there was no difference in the control group between attractive and less attractive players. In the oxytocin condition, it was interesting to observe that controls developed this bias that the borderline patients showed already in the placebo condition. So in the oxytocin condition, healthy controls invested significantly more in attractive players compared to less attractive players. And what we found in the borderline group was that the difference between attractive and less attractive counterparts was maintained compared to the placebo condition, but overall oxytocin reduced the investment with the other player regardless of attractiveness. This is very, actually the graph doesn't show this properly. You need to believe me that it's true what I'm saying, because there was of course quite a statistically broad distribution within the groups already. And interestingly, emotional neglect, as measured using the child trauma questionnaire, correlated nicely with the money transfer in the borderline group. So the more emotional neglect, the less money patients invested in the oxytocin condition in the other group. And no such correlation, of course, was found in the control group because neglect and abuse was almost absent in the control group. Do I have another 5 or 10 minutes?
Cheers, of course.
Is that all right? It's already now 50 minutes.
No problem on time.
Is that okay? So, if you like, I would now finally show you a few data with regard to non-verbal interaction, because that's something I consider very important, because that's what we do in our daily practice. We deal with patients and we interact, of course, non-verbally a lot with them. So, we were interested in the question whether or not oxytocin had an effect on non-verbal interaction in borderline patients compared to a control group. And we used an ethological coding system for interviews. That is, we videotaped all the interviews, and then we took the scale that measured eye contact, affiliative behavior, so pro-social behavior, submissive behavior, elements suggestive of flight, so escape the situation, assertive behavior, gesturing, and so-called displacement activities or conflict-motivated non-verbal expressions of behavior, and relaxation. That were the main categories of the ethological coding system. And actually the coding is fairly simple. You divide a 10-minute interview into 30 intervals of 15 seconds each, and then you rate the presence or absence of a specific pattern of behavior. So for example, typical signs of affiliation are head to side, like this, and bob, and flash is the raise of the eyebrows. Smile, of course, is affiliation. And elements suggestive of flight, for example, is look away, look down, shutting one's eyes. Shin in is this, so kind of self-protective movement. Crouch, and not moving at all, still. And that's also suggestive of flight according to this ethological scale, and so forth. So we measured everything, but eventually we focused on two aspects, namely affiliation and flight. This is the equation. So we found a significant interaction between time point of administration, so whether you gave oxytocin first or placebo first, substance, so oxytocin or placebo, and group. And this, the three-way interaction was significant. Now, this is what we observed actually in patients with borderline personality disorder and control. So the white bars show the results for the borderline group and the black bars for the control group. And what you can see overall is that there is less affiliation in the borderline group compared to the control group, regardless of whether it was under oxytocin or placebo. But the more interesting thing was that oxytocin actually produced more affiliative behavior in the control group than placebo, but only when given at T1. So first point of examination. This was not the case for T2, which we thought suggests that if you know your interview partner and have met your interview partner a week before, there is no additional benefit of oxytocin whatsoever in the healthy control group. And in contrast, there was no sign of increased affiliation under oxytocin in the borderline group as compared to irrespective of whether given at T1 or T2. So they were irresponsive to oxytocin, if you like, with regard to affiliative behavior during an interview. This was slightly different for flight behavior, although not quite significant. So what we found is, I presume because the sample was fairly small, I presume, what I would like to show you is that oxytocin reduced the flight behavior in both groups. So there are some studies showing that oxytocin dampens the activity of the amygdala, so that can be the mechanism why flight behavior is suppressed. But interestingly, one cannot conclude that the suppression of flight behavior automatically increases affiliation. So the two seem to be really separate aspects of nonverbal interaction and not related to one another, and there was also no correlation between affiliative behavior and flight behavior in either group. Of course, there were shortcomings of this study. The setting was kind of artificial. maybe individuals recognize that behavior could be socially desirable and so forth. There is, of course, kind of hierarchy between the interviewer and the interviewee in such studies, but very difficult to control for all these factors. And what we could also not control for was for gender effects. So we had mixed samples, female patient, male interviewer, female patient, female interviewer, and so forth. What we just kept constant was that the interviewer at T2 was the same person as the one at T1. So a lot of things that may interfere with these findings, and we would need much larger samples to disentangle such factors such as gender of interviewer and interviewee, for example. Okay, so this is actually what I would like to conclude. I think ecological contingencies during early developmental stages can have an imprinting-like effect on how individuals experience and interact with their social environments, and also on the way people make unconscious predictions about what to expect from the future, from other people, and so forth, in terms of resources. So these expectations, I think, influence the way they choose sexual partners, and also the amount of investment, as a technical term, in their own children. When you look at neuroeconomic studies, you see that mistrustful inner working models, of course, impact on trust behavior in experimental settings. And here, interestingly, oxytocin seems to boost mistrust in borderline personality disorder, which seems to